As the coronavirus continues to surge in states with low vaccination rates, one Alabama mom is not letting her son's tragic death go in vain. Christy Carpenter and her daughter Cayla are encouraging people to get vaccinated after losing their son and brother to COVID earlier this year. 28-year-old Curt Carpenter passed away in May after battling the deadly virus for nearly 2 months. At the time, none of the family members were vaccinated, and Christy and Cayla are joining us here to discuss. First of all, we're so sorry for your loss. May Curt's memory be a blessing to you and the rest of your family. Can you tell us about Curt and what kind of a person he was?
He was just a pleasure. He was so funny, could be so entertaining. He was very passionate about things that he had strong interest in. So he would want everybody to be just as passionate. He was just so full of life. He lived life to the fullest.
I've seen you do other interviews. I am blown away by your strength. And you know, I've heard you say that it was so frustrating as a mother to not be able to ease your child's pain. I want to get a sense of sort of the timeline here. All three of you contracted COVID at the same time. Now, your son was not eligible for the vaccine at the time, but he was only 28, young guy, no pre-existing conditions. Everything we have been told about this virus is that a guy like your son is gonna be okay. And it didn't turn out that way. Can you give us a sense of how things unfolded and what the timeline was?
So you're right. So on March 3rd, I tested positive. My mom tested positive on March 4th, and then my brother tested positive on March 5th. On March 11th, that evening, I took my mom to the hospital. We just thought she needed fluids. And by the time we got there and started walking back to the triage room, her O2 was sitting about 82, 83. And then that afternoon, or Friday afternoon, March 12th, I had gotten up to go to work, and I went to check on my brother, and his O2 was sitting at 52 by the time that I had called the ambulance and the firefighters had gotten here. So it just happened that quickly, you know, within a week. Both of their O2 stats had dropped so tremendously.
And Curt
And
was
I had not had any kind of breathing problems at all. Even when we left to take me to the hospital for me to, what I thought was just to get fluids to kind of help pick me up because I'd been so nauseated. And from the time that we went from the waiting room back to triage, which we only waited maybe 20 minutes in the ER before they took me back, I couldn't hardly breathe by the time I got back there. And it took me by surprise too, because I had not been having any kind of breathing issues. So yeah, it does hit that quickly.
And Christy, you said that the last thing that Curt said to you was, "This is not a hoax. This is real." What made him think that COVID might have been a hoax? What was his and your impression of the pandemic before y'all became infected with it?
Well, he actually said that to his father because I was in a different part of the hospital admitted with COVID. And but Curt being autistic, he couldn't drive, so he wasn't able to work outside the home. So he was friends with quite a few people online, and a number of them had special needs like him. So a lot of times people think that when something like this hits, that it can't be real. It's never affected anyone in their family. A lot of people turn it into political, like it has, which we don't look at it as political. This is a very serious illness that obviously can kill people. So he could tend, even though he was very intelligent, he could tend to be a little gullible. He could tend to be impressionable, and we would talk to him constantly about it. He had gotten to where he realized this was a very serious illness because we both work in the medical field, so we see it all the time, every day. But I really think that comment was stemmed to let people know here I am struggling. I'm about to be intubated. This is not a hoax. This is very serious. So he was trying to let his friends know that this is serious because he had it. He had grown to learn with us talking to him that he knew it was real, that he didn't believe it was a hoax anymore. But with him laying there with a BiPAP on and about to be intubated and put on a ventilator, he wanted everybody else to know, believe me, this is not a hoax. This is real.
And I know we mentioned it earlier that he wasn't at the time even eligible for the vaccine, but you guys were.
Right.
And I know, Christy, even you were a little kind of concerned about this vaccine, and I think you shared a feeling that many people have felt. It's this emergency authorization. They managed to put these vaccines together at what appears to be a breakneck speed, and I think a lot of people were wondering, how do we know this is okay? You guys got your first shot already, so you're good to go. But I'm curious, from your perspective, do you think that the government has been doing enough to keep people educated, getting the facts out there, but it's getting access to the vaccine, but also like making people feel confident enough to trust the information that they're hearing?
I just think it's just a very large, controversy because so many people have made it more political than I think it's caused more hesitation. I do know that the number of vaccines in Alabama has risen tremendously over the past week. I don't know if our message getting out there has helped in any way. I do know that I have received quite a few messages, thanking us for telling our story, and it did help change their minds, which has been a blessing, and I know Curt would be thrilled. But there's just so many news outlets out there, and there's so many controversy things that are said, and people just don't know what to believe. So that's why I feel like it's important for us to tell our story, because this is real life. This is reality. This is what we went through, and I know other families have gone through the same. And this is what we continue to live through, and we will daily for the rest of our lives because we lost Curt. So, I mean, a big part of me feels like the government's doing as much as they can, but there's just still so many controversies out there and telling different sides of things that, everybody just really has to make that personal choice. We don't judge anyone for the decision that they make. We're just wanting to get the message out there and just hoping and praying that people are willing to take the vaccine, so that way hopefully they won't have to go through what we've been through.
Yeah, Cayla, what do you think Curt would want people to know about what they should be thinking about for themselves and for their families?
I really think Curt would want people to know that age is not a factor. He was only 28, I was only 22, and I still got it. He died from it. So I really feel like he would want people to know that just because you're in your 20s doesn't mean that you're invincible. You can very well catch this and die from this as well, especially with this new variant going on. The average age in the hospital right now is, between their 20s and 30s, and 99% of it is because they're not vaccinated. So people really should take their age into consideration, that it's not just the seniors that are getting this. It is the 20, 30, and 40-year-olds as well.
Yeah, Christy and Cayla, you hear a lot of people who, for the folks who are vaccine hesitant, which is, the statistics on people ending up on a ventilator and dying, people feel that that's a risk that they're willing to take, right? But I always, as reporters, I think we often try to go beyond the numbers, which is why I'm so happy you're here with us today to talk about Curt, because for you and your family, Curt's not a statistic. He was a son and he was a brother, and he was loved by not only you, but by many, many others, and now he's gone. And you don't want anybody to have to go through what you and the 300,000 plus other families in this country have gone through, so that even if statistically the chances of ending up on a ventilator or in a coma or dying may be, something that folks are willing to bear for their abilities to say that they're not getting the vaccine, or they don't want to wear a mask, or they don't want to socially distance. But Curt's not a number. He was a person.
Exactly. I mean, you know, when it comes right down to it, I mean, I'm not afraid to die. I know where I'm going. I'll see Curt again, and my dad and a lot of other family members, but I'm not ready to leave. There's still so much that I feel like God wants me to do here on earth. I'm not ready to leave my daughter. I'm not ready to leave my other family members and my boyfriend. So, you know, I feel like God has given man the ability to be able to create a vaccine that can help save your life. It's not a guarantee that you won't catch COVID, but it is already proven, at least in our location, that it will help you to keep from getting so bad. You know, so the vaccine, and at least from what we're seeing, is saving more lives versus ending more lives. And that's why, I mean, I just feel like, you know, if there is something out there that can help protect you and keep you from getting so bad, then why wouldn't you want to take advantage of that? And that's why, if Curt had been able to have access to the vaccine, and if we knew then what we know now, then we would not have hesitated. We would not have waited. And that's why part of us just feels like, why would someone not want to take advantage of getting the vaccine and just helping protect themselves? Even if they don't do it for themselves, do it for their family, do it for their children, their spouse, their parents, their coworkers. I mean, you know, anybody can catch this. Like Cayla said, this does not discriminate. It affects everybody of all ages. My son was healthy when he got COVID. He didn't have any underlying issues. And there have been a lot of people, including myself, that have caught COVID that do have underlying health issues, and they walk out of the hospital. And my 28-year-old healthy son was wheeled out by a funeral home. So I do not want anyone to have to sit there and watch their family member, watch their child go through this and suffer, and you can't help them. You can't fix it. As a mom, I should be able to fix everything. I've been able to fix my kids when they've gotten sick and give them medication and help them get through it. But with COVID, you can't do that. You're totally helpless. And we don't want anyone to go through that ever again.
Well, I tell you, Christy and Cayla, ladies, you are saving lives by, you know, pushing past your grief. Christy, I can see you still have oxygen. You're still sort of dealing with the ramifications of this virus. So you're pushing through, you know, your own health challenges, and you will save people's lives, and you will save families the grief that you are living through now. I know your son is proud of you. Christy and Cayla, thank you so much.
Thank you. Thank you for having us. I appreciate it.